All right, YouTube, how's it going? Um, I came across an article, and it's titled 30 Things You Should Know About HIV, but Were Too Afraid to Ask. Um, I think these questions need to get out there. I think a lot of people need to understand that HIV is just a disease that you get infected with. It's not an STD, it's an infection. That's all that it is. Okay, so I'm gonna go through this list. Number one, I just tested positive for HIV. Could it be a mistake? In very rare instances, it's about 5% chance you got a false positive. In my case, I got a false negative the first time. So, um, second question: my partner's test was negative. Are they in the clear? Unfortunately, false negatives do happen, like we said with number one. It's best to get a second test done just to confirm. Number three, how did I get HIV? You're not going to know if you've had multiple sexual partners. You're not going to know. You need to inform your multiple sexual partners immediately. I'm going to turn this down. You need to inform them immediately, but other than that, you're not going to know how you got it. And you'll ask yourself exhaustively. You will ask yourself again and again and again, how did I get it? If you don't know how you got it. In my case, I know how I got it. I got high. I screwed a guy without using a condom. It was my mistake. So, number four, is it my fault? No, it is not your fault. No one is at fault. If anything, the only two people who could be at fault in that situation are the people who had unprotected sex, but even then, no one is at fault. You cannot blame anybody, not even yourself. It's just an infection that you got. That's it. It's like getting cancer, essentially. Um, but I thought tops can't get HIV? Question mark. Um, with that question, there's about a 5% chance um, of a bottom transferring it um, uh, to a top. Um, um, Number six. Before we go back to number five, there's an 86% reduction in transmission from a bottom to a top, but that leaves about 14% chance to actually transfer it. Sorry, I'm messaging my bromosexual who I've yeah. Anyways, number six. Is it true that a lot of people with HIV also have hepatitis C? Yes, this is true. You'll want to get the broad spectrum of tests done if you test positive for HIV because there are chances that you have other diseases along with it. Does being number seven? Number seven. Does being HIV positive mean I also have AIDS? No. Absolutely not. AIDS is the advanced form of HIV, and essentially it means that you're at death's door. You are going to die very soon. Number eight, am I going to die? Yes, eventually, but with the right medication and treatment, you'll live a long and prosperous life, depending on what your definition of prosperous is. Number nine. Well, back to number eight. You have to have good access, or you have to have access to good health care when you're diagnosed. Number nine. What if I'm black or trans or live in the South? Here's the sad truth. Okay. Not every demographic has the same chance of seeing positive health outcomes. Essentially, you might not be able to find a provider. You might not be able to get the right medication because of your geographical location, or because of the fact that you identify as trans, or because you're black and you might be low income. Anybody with low income will have a harder time. But you still want to strive to get access to your drugs. When should I, number 10, when should I start treatment? Immediately. The longer you let it sit, the more damage it's going to do to your body and your mind. And that's a bad thing. It's very bad. So, you want to... Sorry, I have chips stuck in my teeth. So, you want to... Sorry. You get to hear all the cars passing outside my window. It's nice being on the 3rd floor. You want to start it immediately because the sooner you start it, you will start killing off, or well, making most of the virus dormant. Okay. Number 11. Do I have to take antiretrovirals every day? Forever? Yes, you will have to, unfortunately. I take 2, so feel lucky if you only have to take 1. I've met so many positive guys who only take 1 pill a day, and I'm like, Jesus Christ, why can't I be that well off? Fortunately, my strain of HIV was mutated and was harder to make dormant. Number 12. Does being HIV positive mean that I have to stop having sex? No! Absolutely not. In fact, most doctors will encourage you to continue having a healthy sex life, so long as you're on medication and you are undetectable and your white blood cell count is high. Number 13. How do I protect my sexual partners? There's a variety of ways. There is PrEP. There are condoms. Oh, Jesus. Sorry, another guy. His name is Ricky. Ricky, he's kind of cute. He's just a little bit cute. Number 14. What is treatment as prevention? I.e. TASP. T-A-S-P. Treatment as prevention means that you become completely undetectable and have a 5% chance of transmitting the virus to somebody else. Somebody who is on PrEP at the time has a 100% chance of avoiding the damn virus. Okay? Oh, Lord. Number 15. What is PrEP? I.e. pre-exposure prophylaxis. PrEP is a drug that, if taken daily for the rest of your life, will prevent the transmission of HIV. So, if you have a partner who is negative, who is HIV negative, because we're all HIV equal, remember that, you want them to get on PrEP immediately. I will tell honestly, I like to have sex without condoms. That's how I am. But I make sure that my partners are protected through that way, through PrEP. Number 16. Do I have to disclose my HIV status? There are a number of reasons to tell your sexual partners. However, in other settings, such as work, school, anything else, you are not required to disclose your status. The only time that I would recommend that you do that is when you go to a hospital, like the emergency room or something, or you're seeing a doctor. You want to make sure that doctors know that you're HIV positive and let them know which drugs you're on as well. Number 17. Will I need to use condoms forever? No. Who is this? Did some Tai Chi. Okay, so no, you will not have to use condoms forever. There are things like PrEP. Let's see. And as long as you remain undetectable, like I said, there's about a 5% chance of passing the virus on to your partner. Number 18. So I can throw away my condoms now. No. You probably shouldn't, unless they're expired, of course. Even if you and your sexual partner are confident that the extra protection isn't required to prevent HIV transmission, there are half a dozen other sexually transmitted diseases that you do need a condom for. Okay. Number 19. What about oral sex? After former TV star Danny Pintaro, I don't know how to... that Danny guy that came out saying that he thought he acquired HIV through oral sex. Alarmists theorized about the dangers of oral sex. The only time that you can get a transmission of HIV from somebody through oral sex is when you have open sores in your mouth, and you, yeah. Number 20. Can I still have kids? Of course you can. There are methods to prevent the HIV transmission to the child so they don't have to go on drugs when they're born. It's pretty amazing. Number 21. How much do I need to tell healthcare workers offering me non-surgical treatment? All healthcare professionals use universal precautions to prevent the transmission of bloodborne diseases like HIV and hepatitis C and to and from patients, according... So, I still say that it's probably a good idea to disclose that to healthcare professionals who are going to be doing any kind of work on you, because they might want to give you drugs that actually diminish your medication, your HIV medication, or make it wonky. So, number 22. Will being HIV positive affect my ability to undergo gender confirmation surgery, plastic surgery, or gastric bypass surgery? No, not at all. You shouldn't have any fear of getting those surgeries, even though you're positive, so long as you are on your medication. I think the entire spiel of today is be on medication. Number 23. What about hormone therapy for transgender people or postmenopausal women? Do HIV meds interfere with estrogen or testosterone levels? According to the Well Project, some studies have shown that both HIV itself and some HIV medications can impact hormone levels. It's probably why I'm a little bit bipolar every now and again. Like right now, I'm actually a little bit manic. So yes, you will have a few problems, but no worries. You can go to your doctor and ask them for testosterone or estrogen or whatever you need. Number 24. Do I need a special doctor for my HIV-related issues? Yes. Find an HIV doctor in your area. Yeah. I did do Tai Chi this morning. It's really fun. I've learned a lot. Yes, you do need an HIV specialist immediately. They will get you the right drugs. Mine is Dr. Thanes Vanek. Dr. Vanek, essentially. He works at Spectrum Medical Group here in Phoenix. His office is amazing. If I need drugs, I go to him. He's now my primary care physician at this point. So, most likely, your HIV doctor will become your primary care physician. You'll switch over to them because they know what you're going through. So, number 25. How do I find support centers or support groups near me? This is a good one. ProjectInform.org/hotlines. If you call the Project Inform HIV Health Info line, 800-822-7422, they will help you find HIV support groups in your area. Number 26. If for some reason I'm bleeding, do I need to worry about people who are helping me? It probably depends on the situation. If the other people who are helping you have open wounds, you want to inform them that you have HIV and you don't want to transmit it. But other than that, you should be fine. External contact with blood that might occur in a sport injury is very different from direct entry of blood into the bloodstream. So if you share your blood directly into somebody else's bloodstream, that's when you're going to transmit it to them. Number 27. How do I answer when people ask, can you get HIV from? Start by telling them telling them how it's not transmitted. Since old myths die hard, we need to stop these old myths. Since the virus cannot survive outside the body, you cannot get it from toilet seats or shared cups or utensils or kissing or anything like that. It's not transmitted through saliva. So you do need to inform them that you can get it from sexual intercourse without a condom, sharing drug needles, or direct blood-to-blood contact. Those are the only 3 methods that you can get it from. Number 28, and this one, I love number 28. Is there a cure? No, not as of yet, but we are working. We are working very hard, okay? We are very close to a cure for HIV. So, and when it comes out, I will definitely be getting it. Number 29. It's been 30 years. Why isn't there a cure yet? Because the virus essentially goes dormant in the blood, basically in your body, and it's in order for scientists to find a cure for it, they actually need to make it active again, so they can figure out how to kill it. So, that's the reason why. Number 30. What will it take for a cure? And I'm actually going to read straight from this. Whatever is used to make those hidden reservoirs turn on needs to avoid making uncomfortable patients sick. So that's the issue, is that when we turn the virus back on, patients get sick. We're able to look at the hidden reservoirs of the virus and try to attempt to, figure out a way to kill it. But then we're risking the patient's life. And as doctors, they don't want to do that. So we need to find a way to have those hidden reservoirs active and then study and observe the virus so we can try to fix it and cure it. And those were 30 things you should know about HIV but were too afraid to ask. It's been a pleasure talking about this with you guys. If you have any comments or questions, please feel free to list them below in the comments section. Go ahead and like and subscribe if you feel like it. I need a lot more subscribers. I really wish that I had more. If you want to share this video with anybody, please feel free to do so. See you guys later. I'm going on a walk with my bromosexual. Bromosexual. Are you a bromosexual? Like, oh my god. Yeah, totally gonna go on a walk with him. He's really cute.